placing one hand over the center of your chest and then the other hand over your baby. So wherever you kind of feel that your baby might be located at the moment, just rest your hand there. And then from here you can just close your eyes and allow yourself to settle. Just notice how everything feels today at this moment in time. So just taking a quick scan around your physical body. Noticing how it feels. Being aware of any changes in your body. And just feel the connection that you have with the ground beneath you. So there's a sense of slightly dropping down and relaxing into the ground. Feeling that your spine gently lengthens up out of the ground. As if the crown of your head is very lightly lengthening up towards the ceiling. And then just notice if you can feel your heartbeat underneath the hand that's resting on your chest. Can you feel just a gentle rhythm of your heart? And then feeling into the hand that's on your baby. Can you feel the heartbeat of your baby? Can you feel a gentle pulse? Can you feel any movement radiating from your baby? And then just resting your awareness on your breath. Becoming aware of the feeling of your breath as you inhale. Becoming aware of the feeling of your breath as you exhale. And noticing how your breath is. And then moving into your Ujjayi or ocean breath. So at this point, if you can very gently contract the muscles around your throat as if you're sighing under the breath, or as if you are making the sound with your throat, but breathing in and out through the nose. Just allow yourself to listen to that oceanic sound, knowing that it's bringing more oxygen into your body, more oxygen also for your baby. It's a very calming and soothing breath, but at the same time it brings more energy into your body as well because of this increased flow of oxygen that it gives. So it's a really good all-round breath. And we've got this quiet sound that's calming and soothing to connect into. So as you continue to breathe in and out, using this Ujjayi method around your throat, only if it feels comfortable, can I ask you as the final part of our warm-up to consider breathing sideways into your ribs. So the next time you breathe in, can you think about expanding your breath into the sides of your ribs? And then relaxing that as you breathe out. And just continuing in that same way. So as you breathe in, expand the breath out sideways into the rib cage. And as you breathe out, just relaxing and bringing the ribs back in. So just do that for a few more times. And the next time you breathe out, you can relax your Ujjayi breathing. You can just let the hands drop back down and just take a moment to notice how you feel. Okay, take the legs out in front, give them a little bit of a bounce, maybe a roll in and out. And then our next move, we're actually going to come and lie onto our right side. We're going to do some stretching into the shoulder blades and into the thoracic area. You're going to need something possibly to put underneath your head, and it will really depend on the kind of proportions for head and shoulder. So if I show you first what's going to happen, we lie on the side, we bring the knees up to a right angle and the arms stretch out in front. We want the back fairly straight, so don't curve the upper back, but you probably are going to need something under your head, because if you don't have anything, you might end up in this position, which can be a little bit uncomfortable. And you can see my neck is now out of alignment. So you might want to put either a block under your head if you've got one, or just scrunch something up like a hoodie and put that underneath. And then I'll just show you before you come down what we're going to do. So we're going to slide the hand up the opposite arm. We're going to take it over the front of the chest. And then when the hand reaches the opposite collarbone, we're just going to drop the elbow towards the floor. And then on the out breath, we're going to slide it all the way back. Now, there's every chance that as you do this, that elbow isn't going to reach the floor, because we're normally quite tight in this position. So you might end up coming somewhere like this, and that's okay. So what we don't want to do is try and get the elbow on the floor and then the hips and the legs come up, because now we're not stretching here. So you want to keep the legs fairly together. However, there may be just a slight drawing apart of them. And particularly if you've got any sacroiliac niggles, you want to let that top leg do its thing. Let it just slide gently away. Now, if you can comfortably get the elbow on the ground, you might then want to open the arms out and actually stay there for a few breaths and have that as your pose instead. Or you might want to continue working with the breath. Okay, so that's your practice. If you want to come onto your right side, just check there's nothing to the side of you. So Camilla, you might want to, otherwise you and Brian, you might end up sort of hitting each other. So lying on your right side, knees are bent up, and then placing your pillow, block, whatever you want underneath your head. Make sure your back is straight, so just check you haven't rounded the upper back. And then take your arms out in front of you. Oh, what, cramp?
No.
Ligament pain?
Big full belly from eating dinner too fast. I'm not used to having tummy muscles to move myself.
So we're going to work with the breath. So the next time you breathe in, you're going to slide your left hand up the right arm, over the front of the right collarbone, and over to the left collarbone. You can turn your head and your shoulders as you do that, and then just let the elbow move towards the floor, the left elbow. And then on the out breath, you slide the hand all the way back. And then we're just going to do that. We're going to repeat it. So you breathe in, you slide the hand up, elbow drops towards the floor. And then as you breathe out, you slide the hand all the way back. So you're just going to carry on and do that with each breath. So this gives you an idea of how tight you are in this part of the body. You know, if you spend all day at a computer, there's every chance that this whole area is going to feel very congested, very tight. And so this is a really good counter pose to any of that kind of forward, leaning forward, hunching movements that we do. So remember, you can turn the head as well. So let the head go with the movement. So as you start to rotate through the thoracic spine, let the head rotate as well. So we're not trying to restrict the movement of the head. It's really just following the line that you are making. So if you can get the elbow down to the floor, then if you want to, you might want to just open up that left arm and just take a couple of breaths in the full pose. However, if the elbow isn't touching the ground, or if you feel that you'd actually like to continue working in the dynamic fashion, you can do that as well. So just going with what feels right for you. And we're just going to take 2 more breaths. So you're either going to hold the open pose for 2 breaths, or you're going to do 2 more dynamic versions of this pose. Okay, and then got a second move here, which is going to get really deeply into that shoulder joint. So it's going to give you a bit of a lengthen through the side. So I'll just show you, and then I'll get you going. So I call this the helicopter arm, because we want the arm that's moving to mirror the horizontal movement of a helicopter rotor blade. So we would start with the arm parallel to the shoulder. We take it up towards the head. We take it back behind us, so we'll roll slightly backwards. We circle that arm down towards the hip, and then we bring it all the way around. Now, in an ideal world, we go full 360-degree rotation. I'm touching the wall here, so I can't do much more there. But there may also be parts of your shoulder that are a bit tight, so you might have to lift up a little bit, or lift down a little bit if you feel that you've got some tightness there. So we're just going to do a couple of these helicopter rotations. And again, this really gets into, yeah, it's a good one, isn't it? It really gets into your shoulder and into your thoracic.
Oh! Dislocating on the floor. I'm not actually, it feels like I'm being dramatic. That's the property change. Oh my god.
Okay, and then the next time you bring that arm all the way around, you can just relax it down. And then you might find that that feels quite spacious now. There's quite a lot of openness happening. So then you're going to roll onto your back, and before we do the other side, I'm going to get you to do some pelvic floor work. So you're going to roll onto your back. You might want to move whatever's under your head, because it might kind of over rotate the head. So if it doesn't feel comfortable, then just move your lift from underneath the head. Your feet are going to be fairly close to the buttocks, but not all the way in. And you're going to, on an exhale, push your feet into the ground and let your pelvis tilt backwards. So it's quite a small movement. The tailbone lifts off the floor, but the lower back connects with the floor. And then as you breathe in, you just relax back down.
So you breathe out, you push your feet into the ground, let the lower back connect to the floor, let the tailbone slightly lift, and on the in-breath, releasing. So we're just tucking and tilting the pelvis. I'm just going to continue for the next few breaths, tucking and tilting. So we use the out breath to push the feet into the ground, let the pelvis tilt backwards, and then we use the in-breath to flatten back down. Now, in addition to that, as you breathe out and you push your feet into the floor, you're going to zip up and tighten and squeeze your pelvic floor muscles. And on the in-breath, you're going to relax. And just do that a few more times. So as you push the feet into the ground, notice how that addition of the feet pushing and the tilting, or tucking actually it is, really helps you to gain a lot more strength into your pelvic floor muscles. So I'm just going to do a few more. And then make this next one your last one. And then you can just have a little jiggle and a little wriggle if that feels okay. And then we're going to come on to the left side. Set yourself up again for that side thoracic twist. So the back is straight, knees are up at a right angle. You've got support for your head, and your arms are extending out at shoulder level with your chest. And then once you're there, on your in-breath, you're going to slide your right hand up the left arm, over the left collarbone, to the right collarbone, and then just let the elbow drop to the floor or drop near to the floor. And on the out breath, you slide the hand all the way back down. So that's the movement. You're going to carry on in that same way. So on the inhale, you slide up. Just let the elbow drop to wherever it's comfortable. Let the head turn as well. So you're not actively turning the head, but you're not actively trying to hold it in a position that it doesn't want to be. So we're more or less just allowing the head to roll as a consequence of what's happening in the thoracic spine. So it's like a passenger really. It's just moving as a consequence of what's happening in the rest of the spine. So you might find it's a little bit easier on this side because we've already done the twist on one side. So notice if it feels easier, looser. Or this might be your stiff side, so notice if it feels harder to do it on this side. So now if your elbow gets all the way down to the floor, you might want to consider opening the arm out and maybe holding the pose statically, or just opening the arm out and then folding it all the way back in. So you can choose for the next 2 breaths if you want to hold the pose statically or whether you want to carry on working dynamically. And when you've finished your next breath, you can come back to the starting position. And I'm going to do the lovely helicopter on this side. So if you're right-handed, the chances are that this will be your tight side because your right shoulder will tend to be a little bit stiffer. So you're going to raise your right arm until it's parallel to the floor. Circle it up towards the ceiling. Circle it back behind you. Go the other way, Camilla. Go backwards. And then down towards your hip. And then circle it all the way back up in front of you. So just going to do that a few times, and again noticing how it feels. So you can let the head roll back, let the chest roll back as you take the arm behind you, and then circle the arm all the way back up. And then when you finish the next rotation, you can relax, notice how that feels. It's one of those ones, it's nice when it stops and you suddenly feel you've got all this space around your shoulders and your chest. So you're going to come and line your back again. So we're going to keep going onto the side, onto the back, onto the side, onto the back. We're going to keep the knees bent, and this time we're going to increase that little pelvic tilt. So I'm going to invite you to just rise up as little or as much as you feel you want to. So we're going to push the feet into the ground, tuck the tailbone under, and then if you want to, you can rise up off the ground. So this is a good one to strengthen your glute muscles, but you also get a little bit of a back bend on the front of the body. And then you might want to peel down. So Claire, this might be a good one for you. So any sort of inverted positions, they, obviously providing that there's space. So this could be quite a good one. So what I would suggest is do that and then do some pelvic floor squeezes, because that kind of energy going upwards, that little pulsing, might make him shift his bum out of your pelvis.
Yeah.
It doesn't feel comfortable.
No, it does. I can feel his head
Just there. Okay. Little monster. Well, it might be not his fault. It might be you. It might be your pelvis. So you're going to do one more. So you can actually do a supported lift.
It actually feels alright.
Well, I was thinking if you could hold it for quite some time, then you haven't got to rely. So you just come into that position, get your husband to just prop blocks, books, cushions, whatever, until you're until it's comfortable, and just lie there for a bit. Until and then if it stops, obviously you've got blood pressure to think about. So when that starts to be an issue, then you calm down. But yeah, hold it for a bit, and then do loads of pelvic floor squeezes, because I think babies feel that. And it's, they're like, ooh, what's that? What's happening? So they might just come up, it's worth a go, isn't it? At this point, I think it's worth a go. Okay, so you're going to come back onto your right side, and we're going to do some pelvic girdle strengthening work. So line your right side, but this time you don't need the pillow, because you're going to prop yourself up onto your elbow. So the knees are bent. Again, up at a right angle. Your ankles are going to stay together, and as you breathe in, you're just going to lift the left knee up, and as you breathe out, you're going to lower it down. We're going to do that 10 times. So you're not rocking the hips back, so we're not trying to make a really big movement by taking the hips backwards. We actually just want the thigh to move in the hip joint. You can see the difference. When you just do it like this, it's actually really hard work, whereas if you kind of try and make a big move, but the hips go backwards, it's just a pelvic twist, you're just twisting in the spine. Whereas this one is working your glutes and your hip flexor muscles. So you kind of know about it when you're doing this one. But it is really good for all the reasons that I've mentioned before, to just do a little bit of pelvic girdle muscle toning on a regular basis, along with pelvic floor toning. Mostly when you're pregnant, you kind of just want to stretch, don't you? That's what you kind of feel you need. But there is this inherent need for tightening up a few things as well. Okay, I'm not counting mine because I'm talking, so I'm going to rely on you to know when you have done 10. You're all going to tell me, yeah, I've done 10, I've done 10 already. Okay, so the second thing we're going to do is to take the top leg and just bring it horizontal to the floor. And then we're going to slowly take it forwards, just as far as you can come. It's probably going to be the hamstrings and the calf muscles that restrict you. And then we're going to slowly take it backwards as far as it will go. So again, you're working a big range of muscles here. You're using your own body weight, so the weight of your leg is providing that bit of extra work for the glute and hip flexor muscles. And then you're going to bring that knee down. Now we need to take it slightly forwards now, because what we want to do is work the underneath leg. So you've got a couple of options. Some of you might be comfortable just to take the leg over to the floor, but however, a lot of you, particularly if you've got any sacroiliac niggles, you might feel better to put your cushion, your block, your pillow, whatever you're using underneath the knee, so it maintains a little bit of neutrality and alignment, so that your sacroiliac joint isn't kind of tipping too far over. Then you're going to flex your right foot. You're going to pull the toes towards you. You're going to breathe in, lift the leg up. Breathe out, lower it down. So that's working the adductor muscle that runs along the inside of your right thigh. So you're going to do that 10 times if you can. It's also working a little bit of the hip flexor on the right hip as well. So this adductor muscle that runs along the inside of the thigh is a really good one to strengthen, because it's the one that holds the symphysis pubis together, or helps to hold the symphysis pubis together. So it's very good for reducing the possibility of getting SPD, symphysis pubis dysfunction, which is quite endemic in pregnancy. Now, if those muscles get tired before you've done 10 rounds, then it's quite okay to stop. If you're not used to working these muscles, you might not get 10 rounds out of it, and that's fine, because I will keep you doing these until you have your baby. So by the time you have your baby, you will have thighs that can crack walnuts and a really strong pelvic girdle. That'd be a great party, wouldn't it? Okay, so again, I'm not counting, so I'm going to leave it up to you to know when you've done 10. Then you're going to come onto the back again, and I'll show you again what's going to happen here while you can still see. We're going to do some hip opening and some shoulder stretching. So I want you to take your arms back behind you, but I want to get all of the arm on the floor. So often when we're tight in the shoulders, when the arms go back behind the head, you get into this position. So I want you to take your arms wide. I want you to take your hands and your wrists wider than your elbows, so that all of your arms can come on the floor. You'll feel a stretch around your armpits and around your pecs and pectoral muscles. Now with your feet, you're going to take them slightly wider than your mat. So just let your feet touch the outer edges of your mat. And then what you're going to do, as you breathe out, you're going to take both knees over towards your right side. So you're getting a twist in your hip. There's a little bit of a twist in your shoulder, a little bit of a twist in the belly, but most of it is going into your hip. And then on the in-breath, you bring the knees all the way back up. And then as you breathe out, you take the knees over to the left side. And as you breathe in, the knees come back to the centre. And that's it. We're just going to do that a few times. So it's quite a nice move. You get a really nice internal rotation on one leg and an external rotation on the other leg. We're just going to do one more round, which will finish when you drop the knees over to the left side, and then you can come back to the centre. How does that feel? Does that feel okay in the hips? It's quite a nice stretch, isn't it? And then you can just lower the arms, you can bring the legs back together, and then you're going to come over onto your left side, and we'll finish off with our clamshell practice. So lying on the left side, knees again just coming up, support your head on your hands. So the ankles come together and they stay together. As you breathe in, let the knee lift up, but without taking the hips back. And then as you breathe out, lower them down. So we're going to do that 10 times, or as close to 10 as you can get before the muscles get too tired. And then when you've finished your 10, you can just relax, maybe give the legs a little bit of a shake. And then you're going to stretch out the right leg until it's parallel to the floor. You're going to push the heel away and you're going to slowly move it up towards the front of your body so it stays parallel to the floor. So a little bit like the helicopter move, but we're just kind of pendulum swinging the leg. It stays parallel to the floor as you swing it slowly back. So it's not really a swing, it's more of a very slow, controlled move. And then we slowly guide it forwards. And then we slowly take it back. And again, all the while that you're making these movements, because you are holding the weight of your leg with your hip muscles, it's kind of weight training, but using your own body weight. And then when you're finished, you can just relax that leg down. And then we're going to support that knee. So this is where we're going to use the left knee now, the left leg, and the right knee just kind of comes forwards. So you've got it resting on either your block or your cushion. And then you extend the left leg out straight and you push the left heel away. And as you inhale, lift the leg. And as you exhale, lower it. So 10 times if you can. Keeping the leg straight, pushing the heel away so the foot is flexed. And then when you're finished, you can just relax everything. So I've got one more move on the back, which is going to stretch the hips and the hamstring again. So these are big stretches. They're not necessarily done standing up. So you might want to have a look at this one. We call it in the yoga classes, we call it the reclining pigeon pose. It's a really good stretch for the hips. So what you're going to do is take your ankle bone to rest on, so we'll start with the right leg, right ankle bone rests on top of the left thigh. And then to deepen the stretch, we bring the left knee up. Now, depending on where you are in your pregnancy, you might be able to get the hands through. So if you're in the early stages and there's still a bit of space around your belly, you might be able to interlace your fingers under the back of your thigh. If you're getting towards the end of your pregnancy, that's not going to be an option. So you keep your hands on the floor and you may just be able to breathe the knee forwards and backwards. So you should feel this in the hamstring and the hip, outer part of the hip.
Are you supposed to be able to actually lift your leg off the floor? Ah,
I can't actually do it with my leg.
me neither. Jesus, am I in the wrong position?
No.
There's nothing happening.
Oh, you're
Have you
doing
grabbed
it.
the trousers?
Have you had to take
There you go.
There's no.
I actually can't.
There you go.
Is that how it's supposed to look? No, I can't.
And then relax, and then do the same on the other side. So taking the left leg over now.
Oh my god.
I can lift that side.
Is that mainly because your right thigh, you've got more muscle in your right leg because it's your
No,
dominant
there
leg?
wasn't even nothing's happened. That's really weird.
I'm just like using my 20 muscles together.
And then release.
How I was using my.
And calm down. It's always interesting when you come and do something like yoga for the first time, you find a lot out about yourself.
Oh, I'm really unflexible. I already knew that.
Well, I find out I've got one leg longer than the other, got more muscles that don't work in bits. Yeah, when I first did it, it was all kinds of things. Okay, let's slowly come up onto your hands and your knees. So we'll have a little bit of stretch for the back. So you're going to make some space for your baby between your knees. So again, this bread and butter pose of stretching the spine all the way back onto the heels. So as you breathe out, you're going to tuck your tailbone under, roll the spine to the ceiling, and at the same time, slowly bring your hips all the way back towards your heels. So you want to keep the back round, so you're really getting a stretch in the lower back. And then on the inhale, you're going to push into your shins and rise all the way back up. And then on the out breath, roll the spine to the ceiling again. And gently bring your hips all the way back to the heels. And as you breathe in, push into your shins to rise all the way up. And just do that 2 more times. So feeling the back starting to slowly open. And then when you come back this time, you can just bring the knees back into a neutral position. You're going to stretch the right leg behind you, push the heel away, and then drop the foot flat down to the floor. The left shin might feel comfortable, just kind of going back a little bit to give you a bit more support. And you're going to push into the left hand, so use the ground, push into the left hand, just float the right arm up to the ceiling, and then we're going to lengthen into the side of the body. So lift the right rib cage away from the pelvis and let the right hand extend over the head into the center of the room. So you're drawing the right hip down towards your right foot and the right rib cage up towards your head. Take a breath. And then just circle the arm all the way down to the floor. Swivel back onto the ball of your right foot. Bring both feet down to the ground, and then we're going to press back into down facing dog. So we haven't done all the hamstring work at the moment. So this is your opportunity to just stretch back into the hamstrings, just dropping one heel at a time towards the floor. Keep pushing into the hands so your spine extends. And then bring the knees all the way down onto the floor. And then from here, you're going to take the left leg back behind you, push the heel away, so lengthen into the back of the leg. And then drop the left foot to the floor, but you might want to turn the right shin out slightly. And then you're going to push into the right hand
and let the left arm float up to the ceiling. And then you're going to lengthen through the side of the left waist and draw the left arm over the head. So you're going to lengthen the left hip down towards your foot, and you're going to lengthen the left rib cage over the head. Take a breath. And then circle the arm down to the ground, swivel back onto the ball of your foot, bring the foot down to the ground, tuck the toes under, press back into downward facing dog again. So just easing out a little bit more, working into the legs and feet. And then bring the knees all the way down onto the ground. Tuck your toes under, walk your hands back towards your knees, lift the knees off the floor, drop the heels, and then you're going to dangle forward. So make space for your baby, so widen the knees if you need to. Just have a little dangle here, maybe swaying from side to side, maybe just releasing the head and the neck. And when you feel ready, slowly uncurl. And come all the way up until you're standing.